From Eden. Good to see you again, and I was wondering if you could remember all those years ago when I came to see you, let you know that I was a dental specialist accountant, and I knew that you were doing marketing specifically in that space for dental clients and looking after their website and everything else. And I said, could you help an accountant and do my website, which you've done, which has been really good. You've done my second website as well. But here you're now expanding a bit. You're providing a bigger range of services for dentists. What are you doing now?
Yeah, well, Albert, time flies, as we all know, when you are in a good time. I mean, when I say, when I started about, I think we have known over 10 years, but it's almost 17 years in the whole branding and helping and marketing. People say, oh, you are that old. And I said, no, I just happened to start the business in just 7 years old. So anyway, my point here is to, of course, we started with the humble beginnings with, helping dental practices on their brand, especially on the website, online presence, and then of course the marketing, bringing new patients, whether that may be cosmetic, implants or aligners, those high-end patients. Now guess what happened is we were actually navigating about how we can solve the problem, especially in 2019, just before COVID. We're thinking, okay, there is some unusual problem because clinicians are so busy on checkups, clean, especially high-end, as a practice owner, you would understand. Many of the clients are almost on the burnout stage because they have grown or outgrown so much in different years or different locations. And then the problem is, okay, my growth is a sort of a stagnant. And what do I do? Then of course the question is scaling. Mainly that drum up more on COVID time. So 2020, 21, we're getting a lot of calls from our corporate clients or high-end clients. So we have multiple locations, multiple clinics, particularly the one I remember is from the Gold Coast one. They have got multiple in clinics in a regional, on that in the whole Queensland area. So some of them are, okay, Praveen, I got a call, and then around 2020, 2021, okay, look, Praveen, we have great time getting a lot of veneers patients every week, 5 to 7 cases a week for all cases in different locations. We're really good, but now we have a different problem. I said, what's the problem? Look, even though we would like to in different practices, the problem is now we don't have clinicians to help. So literally some of the practices we can't serve. We are literally only opening 3 days. So that keeps us thinking. And then long story short, what we did is, of course, the clients were asking, okay, can you bring the clinicians like how you are bringing the patient? And I said, no, this is a recruitment. I said, look, I don't care what it is, but point here is we need someone to help you. All the patients you are bringing, we need people to serve. And that's where we started that journey. So I will still say I'm not a recruitment expert, but what we have built is, really that community, and we built that practice, the particular group, bringing the dentists from UK, Ireland, and New Zealand, where, pretty much the ADC is pretty simple to register, and in few weeks all ready to hit the ground. So that's what we have done, and of course use the migration. So as a tool or a vehicle for them to sponsor or for them to bring here and help in your practice. So from there we started now, pretty much our focus right now is helping our clients, especially our existing clients, to helping them to retain the staff. So if you're watching this, there's 2 things here, especially if you have a practice in regional areas, then there are certain provision from the migration perspective. We can help to, recruit. That's where we started the academy as well, dental academy, where the new ADC grads comes up. But, again, passing rate is very, very low. So, but we're giving all the priorities to our clients. That's one thing. But second thing is there might be already existing staff on many practices. So, and guess what? These staffs, many times the practice would like them, they trust them, but they are not on a right visa. They are overseas, let's say dentist, overseas therapist, or overseas might be technician. So perhaps, there might be opportunity for you to sponsor them. There might be opportunity for you to have them for 3 to 5 years. That's something we are helping at the moment through migration. So we have got our whole migration experts who understand the dental, and side by side we work with them. And everything is confidential for keeping them, retaining them, and that's what we are focusing it right now. So what does that all means is all on a growth side for a sustainable growth, and that's what I think you teach in your CPD lectures, and we deliver that is all about sustainable and profitable growth.
That's exactly it. Praveen, is it only the dentists you're recruiting, or do you do dental hygienists, or do you do dental nurses, or that? Because I know certainly the DAs seem to be a problem everywhere, particularly in regional areas, to try and get someone there to help at the clinic.
So great questions, Albert. It's a whole dental team member. So it's not just the dentist, hygienist, DA, dental nurse, dental technicians, and guess what? Some of the files we have done is like 100% success rate. Even like some of the laser machines we put as a technicians, it has came out well. So point here is the government is without too much complications. The government is giving a bit of provisioning, especially if the practice is in regional or outback or the remote places. So we are helping clients right from Northern Territory to Perth, down a couple of hours, and then whether that may be Darwin, Townsville, or that might be Shepparton. So all that designated area of migration, which in a migration code of conduct they say as a DAMA, so that falls around that category. Perhaps also other ways, sponsoring through the regional as well. So there's a number of ways, but in a nutshell, we can help them, not just finding the dentist, but helping them to find other individuals or other team members as well.
Excellent.
So I hope that's given you a bit of idea. So if you're looking for, the recruitment, or if you have already got the right candidates and you're looking, okay, how can I sponsor them? How I can retain for 3 to 5 years, perhaps just reach out to us and see how we can help. Thanks for watching.